There is new concern over the spread of COVID-19 in Ontario, where new reported cases are still being counted in the hundreds every day. Data shows that more young people in their 20s are testing positive, especially in the Toronto area, which remains one of the country's hotspots for the virus. We begin our coverage this hour with Laura McQuillan, who has the latest numbers and this trend. Good morning, Laura.
Good morning. Yes, as other age groups have managed to flatten the curve, it's still rising for those in their 20s, and experts aren't exactly sure why, so that's where their worry is. But take a look at this number. This is something that really stands out. Hamilton, Ontario, over a 10-day period, found that 43% of its new positive cases were people aged in their 20s. Now, here in Toronto, similar rises with more people in their 20s picking up COVID-19, but it wasn't linked to what you're seeing on your screen. That episode where many young people turned out to Trinity Bellwoods Park on a beautiful summer's day. There were a lot of concerns about a lack of distancing there, about people gathering in large groups, but experts have said, in fact, no spike in cases has been linked to that very day. As for what might be behind this, well, there are a number of theories, but one of them is more testing. Since the testing criteria was expanded in Ontario from just severe cases to anyone who wants to get a test, that might be encouraging more young people to get tested. They are more likely to have a mild case of COVID-19. Now they can go check it out. And when you spoke last hour with Dr. Samir Gupta, Heather, something that stood out is that while he said it could be testing, it could be other things as well. Take a listen.
The other possibility is that young people are in fact getting this virus more now. And if that's true, it may be a function of the fact that young people are restricting less and maybe being less careful, and maybe they're congregating more. And we've seen some examples of that. And even, small pockets of congregation like that can lead to small outbreaks that might be driving these numbers. So it could be either of those or a combination of those factors.
So looking at those possible explanations, Laura, what are public health officials now doing?
Well, they're working to pinpoint exactly what factors might be behind this. Is that people are flouting the rules? Is it that perhaps they're going back to work and getting infected when they commute or when they're in their workplace? That's something that is top of mind for officials in Hamilton, Ontario, where we saw that big spike, that 43% of new cases being people in their 20s. They're rolling out a new social media campaign aimed at that age group, reminding them of those rules, those guidelines they should be following, wearing masks when they can't stay 2 meters away from others, only associating with people within your bubble, remembering to wash your hands. Toronto's Chief Medical Officer, Dr. Eileen de Villa, has said she's also wanting to get to the bottom of what is going on in Toronto. Here's what she said.
If, our data suggests that physical distancing is not being as diligently practiced by younger members in our community as it should be, then I think we'll take our actions and direct our actions towards addressing that situation.
So officials admitting there is work to be done to track down exactly what is going on with that group that's seeing that rise in cases, because of course, while younger people might only have a mild case, some can be really severe and they can certainly pass it on to others as well.
Laura McQuillan, thank you very much.